Hello, this is Mark L. White with Health Hacks, and I have my really good friend, Dr. David Garcia, joining, and you're going to talk to us about brief biohacking, brain, body, and boners.
That's right. Yeah, it's a biohacking tidbits on how to optimize your body and your brain and your body and in your sexual well-being, right?
Bedroom
Um,
performance.
Go ahead.
Bedroom performance.
That's right. That's right. So, as we get older, as boys get older, men get older, we start having our hormones start to reduce and things happen in our bodies. We can have comorbid diseases, high blood pressure, diabetes, obesity. All these things go against us in our body, in our sex life, and also our brain. So how can we reverse these things? These are the things that happen to most guys. Age related stuff, and we want to reverse that. So what can do? What kind of biohacking things can we do? So I did break this down to brain, body, and boner. Probably the first thing is like body. Actually, this hits all of them. Okay, brain, body, and boner.
Has a guy ever gone to see you? I've known you for a while. You're up in Columbus, Ohio. You've been an
Yeah,
integrative practitioner now for what, 20 years?
yeah, over 20 years. Yeah, right.
You're a legend in this. Has a guy ever gone to see you not looking to optimize brain, body, or boners? Or does that cover everything?
Well, you know what? If they come to see me for one thing, a lot of these things are cross current. They'll spill on over to other areas, and so they'll get better. Let's say they come in, they want to be have a better body form. Guess what? It's hard for me to just treat body form without treating the brain. There's a spillover into the brain and sexual health. So, has anybody come to me not seeking brain, body, and boner? I guess a weight loss. Weight loss may be one of those things.
But that's body.
That is body. That is body. Um, Maybe supplements, which is also body.
Or brain or boners.
Right, right. So all these things are filter out to other areas as well. So it's hard to be, this one thing only treats this and nothing else. There's a lot of spillage over. So I guess I can't think of anything that's come to me outside of this in 20 years. It's always part of this.
Yeah. I think if I can just go with an optimized brain, body, and boner for the rest of my life, I'm a happy guy.
Yeah, right. Most guys are happy.
Right.
Get your sex
Very
life.
simple. Very simple, guys.
Yeah, and life, and when you have great sex life, well, a lot of things fall into place. Your mind and your agitation, the ease, how you view life, all these things. So probably the first one, Mark, you really want to hit is hormones, right? And everybody knows the classic male hormone, testosterone. You want to make sure you evaluate that and get that centered, in a right locate in right in alignment where you're at. Most guys' hormones tend to decrease over time. That's just an issue as we get older. These hormones decrease, testosterone specifically. Our sex hormones are on a time to release to die off. You should have your sex and have your kids, and then that's it. Hormones start to decrease, but then because
you have your kids, you're useless now.
Yeah, right. You should die. The next generation. I mean, but testosterone hits so many things. Without these hormones, you can feel listless, fatigued, no energy, fuzzy thinking, insomnia, body aches and pains, weight gain, no libido. You can have cold hands and feet. Poor skin. All these things kind of add up. That seemingly have nothing to do with hormones, but they do. And so if you optimize the hormones, guess what? A lot of these things tend to be mitigated, reduced, or really mitigated, so that life is so much better. You have a transformation, actually, how you view life, how you look, your energy pattern, your gregariousness, your funness, versus being a crotchety old man. So nobody likes
old man syndrome.
Yeah,
Get off my lawn. Like the fist.
Right.
So, but why do you think, I agree with you, by the way, like testosterone, every guy over the age of 50 probably can use a little bit of testosterone.
Sure,
but
totally.
why isn't every guy over the age of 50 on testosterone?
Well, I always wondered that. And I treat women here as well, and they want to bring their husbands in, and they know the whole story. But I always say you can lead a horse to water, but can't make him drink it. And so I don't know what it is. It's a approach avoidance and know what's going on, but they don't want to deal with it, or it's something new. And they're so, I don't know. I'm just conjecturing. They could be so stressed out, or too many things going on in their life. They don't need something else to think about, which actually can make their life so much easier. And so, a lot of people don't do the things that are good for them, and because they know what they know, and they don't want to really break out of their habit, whatever their habit is, or whatever they do on a daily basis. They don't want to change anything. So that's where I put it at, or they just don't believe it. They really don't believe this really can be transformative. It's just unbelievable. Really, come on, give me a break. It's not really going to happen. Yeah. Things can change. So, I mean, that's where I put it at from my perspective.
Are you putting a lot of guys on injectable testosterone, or are you seeing guys now using creams and pellets?
I mainly injectable or pellet implantation, both of them. I only have a handful on cream, because cream's, it's variable. The skin is a semi-permeable membrane, right? Some people have very good skin and nothing gets through. So you can crank up the concentration, nothing gets through. So it's very variable. So I always say creams, I'm playing with it. Really to really deal with the issue. It's more injectable or pellet implantation. Pellet implantation, I think, is the best. It's more consistent throughout the day rather than the injection, which can be, you can have a high right after you inject, it kind of drops off. And so it's more consistent with the pellet implantation. So I like to get those, in line. And everybody's different. You have a range of normal in general, the upper 1/3 of the normal range, not outside the range, but not below the range or low range.
One thing is, as we get older, that range, if you look at some labs, that range starts to
right
shrink. And some people will say, like, it's normal that it's shrinking. We don't want you at an optimal level for a 30-year-old.
Right.
And so I guess the question is, why would they have a shrinking range, or why does our body produce less and less testosterone? Like, why have we evolved from that?
Well, you have a shrinking number because it's a bell curve, right, over all the people that age, and most people, that median tends to go down as you get older. I mean, just like we said before, right after sex, the testicles don't produce, slowly over time, produce less and less testosterone, and to a point where you have minimal testosterone, and it's just a program that's built into our body why we over time we have less testosterone. But there's something else going on there as well. Testosterone levels in general have fallen across the board over the past generation.
Why is that?
Why? Well, they're thinking pollutants, estrogen-like compounds and plastics, many different, just the pollutants, basically the 21st century, late 20th century pollutants causing it. But they really don't know.
I read an article, I think it was actually today, that said that men today produce less sperm. Than
half sperm, right?
Than half the amount of sperm than they did 50 years ago. And I would assume that's related to the production of testosterone somehow.
Made in the same gland, right? Made in the testes. So the testicles seem to be producing less. You're right. There's a point where it could be an issue where the reproduction of the species may be in jeopardy if it's producing less and less sperm. But I think probably, I'm conjecturing, it's probably from the same issues, that the pesticides or whatever kind of chemicals that are in our environment that are causing this.
So you get back on testosterone, and it is a major issue right now. Testosterone levels are low. We're producing less sperm.
Yeah. I'm sorry.
I was going to say, testosterone. What other hormones are huge right now for guys? Like, what hormone should every guy be on?
Okay. Well, as you get older, and not only testosterone levels drop, your growth hormone levels drop as well. Probably after age 35 really takes a plummet. And that's growth hormone. It should be known as a regenerative hormone. It's very restorative. It's more slow acting than testosterone. I always say it comes in through the back door. It's very subtle. It's good for muscle mass and skin thickness and body form, collagen, but it takes longer. It's more subtle hormone. So growth hormone levels should be optimized or increased because if they go down real low, and usually measured through a blood work called IGF-1. And that can be treated either through growth hormone itself, which is a injectable, or through peptides, which help stimulate growth hormone from the pituitary gland. Peptides you can inject or actually take underneath the tongue to help stimulate the pituitary gland and make growth hormone. So that's one hormone. Other hormones are. Any questions on the growth hormone at all? I don't know.
No, I think 15 years ago, I think growth hormone was very popular, but now with like the advent of peptides, and you see peptides for everything now.
Right. Yeah.
It seems that like an integrative practitioner can produce whatever desired effect the person's trying to achieve, whether it's better sleep, better brain function,
right,
whatever, using those peptides. But there's a lot of, I guess my question is, how do you know what peptides to put somebody on? Because there's a lot of like,
that's a question. So it is a trial and error. I mean, there's CDC 1295 as a peptide, Simorlin and Ipamorlin are peptides for growth hormone. You can use those either singly or in combination. And I have to tell you, we're all different animals, right? We all need growth hormone. We all need our hormones, but we all respond differently. That's why nobody's the same. Everybody has a different sweet spot, so to speak. So it is a trial and error. You use a certain kind of peptides and you see if it works. Some people, a certain type of peptide works. Other people it won't, and you have to reevaluate. And
do you notice that gets a better result in growth hormone?
One thing about growth hormone, it can very similar results, I think. Not a better result.
Yeah.
I haven't seen a better result with than growth hormone. I've seen very similar results with growth hormone with peptides, but not a better result. So I don't know. Have you noticed that a better result with that with peptides?
Well, I think I've taken growth hormone before, and I think one of the things about growth hormone is I did notice that once my blood sugar rose a little bit after taking it for a long time, so I had to get off of it for a while.
Yeah. You can have some side effects of too much growth hormone. You can have swelling in the fingers and joints, blood sugar, that kind of thing, or taking too much acromegaly. Yeah, you're taking super high amounts,
like the guys with the big chin and the big forehead,
right? Big face. You don't go tall. You go sideways, right?
So, but I haven't taken a lot of peptides. I like taking growth hormone. I think it's one and done, and it has worked very well. Like it's helped me stay focused and energetic.
The benefit of peptides is that with growth hormone, instead of growth hormone, is that you can't overdose with peptides, because it stimulates your own pituitary to make your own growth hormone. And so there's a natural biofeedback mechanism with the production of your own growth hormone. So if you have too much, it will shut it down. Versus you can override your own system by injecting your own growth hormone. It just overrides it. So that's that's another hormone. And other hormones are like thyroid. Thyroid determines metabolism. You want to make sure that your metabolism is in a good range. Slow metabolism would present itself like cold hands and cold feet and cold nose and constipation, dry skin, dry hair, dry nails.
Do you get a lot of guys coming to you with that need thyroid?
No, more women actually. More women. Thyroid is like more like icing on the cake. We're just trying to tweak everything the best. So for whatever reason, I have more women on the thyroid than men. And then the other hormones are the adrenal hormones, like DHEA and cortisol. Yeah. These are stress hormones. They go up with stress. A lot of times I see guys with very low levels, but is that it's not they don't have any stress in their lives. They have too much stress. They have constant
workout.
What's that?
Their adrenals have just
that's right. Yeah. So the stress is still there, but they run out of hormones to deal with it. So I always say it's analogous to the house is on fire, but you just don't care anymore. You just don't care. You have no energy. So how do you treat that? Well, you can treat that with the hormones themselves, DHA, which is our oral medication. It can also be transdermal. And cortisol, it's another hormone you can give an adrenal extract to help the adrenal gland kind of rebuild itself. And also Cortef, which is hydrocortisone in pill form, just as a short-term bridge device to really take some pressure off your adrenal gland while it heals. And because the adrenal gland can be rehabilitated. It's not on that course of destruction like the testicles are. It's not a built-in program that has a short lifespan. Adrenals can last a lifetime, but they can come back to life over time.
So when guys are coming to see you and you put them on a regimen of hormones, growth hormone, testosterone, whatnot, how often do they have to come back and do the follow-up labs?
I see them approximately every 4 months. I mean, because usually I have most of my men on pellets. Pellets completely are gone in 4 months. And so I'll come back and see them. So I do monitor pretty closely their hormones. I always look at PSA and, and make sure their PSA doesn't get elevated. There's any prostate issues. I also monitor their hemoglobin hematocrit to make sure their blood density, not getting too viscous of blood, which can be a side effect of testosterone therapy. Also, the side effects, I want to make sure their estrogen and dihydrotestosterone don't get too high, because testosterone can convert over to estrogen and dihydrotestosterone. You want to keep those, within normal limits. Estrogen's associated, too much estrogen's associated with, the man boobs and, weight around the middle. And dihydrotestosterone is associated with male pattern baldness and prostate issues. So I want to keep those in check.
So everything you do there is focused on brain and body. Do you also, what biohacks can you give in terms of what we're putting into our body, in terms of food, in terms of, we all know sleep's important.
Sure. Sleep, nutrition, exercise, correct.
Nutrition, exercise. What would you say to the guy who comes to see you and says, look, I don't sleep well, I eat like shit, I don't exercise, I want the hormones to do everything?
Well, you got to do something. Well, one thing about it is that he probably feels that way because there's no motivation, right? And so you're really treating the brain. The hormones can help treat the brain where you have more motivation and get rid of that fuzzy thinking. And once you have the motivation back, you actually can work out and be motivated to have a better diet. So there's it's not good to treat hormones without anything else. It's just, without any diet or exercise. I think you may feel better, but hopefully the motivation comes in that you can actually do these things. You should never just go it alone. Hormones, nothing else.
I think it's funny when you have these guys that believe in magic beans.
I wish there was a magic bean. I have to tell you, a few years ago, there was, really pure people were doing really hormone replacement therapy, and everybody's just kind of fading away, become couch potatoes, watching TV. It doesn't have to be that way, where you're more motivated, have more energy.
Yeah.
You can get things done, do things after work,
So we talked about brain and body. We haven't talked about the third B.
The boner. Okay.
Boners. Talk away.
Well, that's third. Okay. Well, okay. We can talk about ED, erectile dysfunction. And so, yeah, that's an issue, right? It's a prevalent issue currently across the United States. It's epidemic, and nobody likes to talk. I guess people don't like to talk about it. I talk about it pretty easily, but I guess, in polite society, it's not a subject you bring up over dinner, I guess. But it is prevalent. And so it goes down with where hormones go south, right? And just the poor food choices that a lot of men have, a lot of women as well, but causing obesity, causing high blood pressure, diabetes, smoking. All these are risk factors to increase your incidence of erectile dysfunction or boner, right? And so so all these are issues, and because they cause problems in the endothelium, in the inside the blood vessel wall, endothelial dysfunction so the artery of the veins don't really dilate as easily, and so you don't have engorgement of the penis, and so there's lack of that. Mm-hmm. And then you have, if you don't use it, you lose it kind of scenario. The less you use it, the less you tend not to use it, and then that whole cycle starts to build on itself. Next thing you know, you're not using it for anything, right? So how do you change this around? Well, first of all,
You got to get the wife in there and like give her a prescription to have sex with her husband every day, so it's at least being used.
yeah, that would if that would work, that'd be great. Yeah, yeah, something, if it's just kind of manipulation, if you're having some kind of blood flow going on in the area, it's all about blood flow. There's no blood flow, nothing's working. You need blood flow to the penis, or it is going to be flaccid. So how do you do that? Well, one of the first things, you could use a nitrous oxide supplement, right? Nitrous oxide helps relax the venules and the veins and the arteries so that there's dilation, and actually fills the corpus cavernosum, the penis, the sinuses in there, so there's engorgements, right? And that tends to decrease over time as well with age. So there's all kinds of supplements. L-citrulline's one, and also citrates are also another one. Green leafy vegetables, anything that has NO in it.
How does that compare to the PDI, to the Viagra, Cialis, versus like, these are supplements you take daily? Do they work right away, or is it something that has to build up?
No, they can work they can work. Yeah, they can work. Cialis and tadalafil, those are phosphodiesterase inhibitors. And so they break down, they inhibit phosphodiesterase, which breaks down a product of NO that causes the relaxation of the venules. And so which means the end result is that you have a more of a better erectile function, better blood filling of the penis. So yeah, they work well. I mean, if they work well, if you have a good level of nitrous oxide, it's even better. So it's good to supplement with nitrous oxide along with the PD5 inhibitor, tadalafil or Cialis. One thing about tadalafil, it tends to have like a 36-hour half-life, so you don't have to take it like an hour before sex. You can take it in the morning, and then at your convenience that day, it should be able to
the gift that keeps on giving.
Yeah, so that's a great gift. I mean, there's a lot of side benefits with that too. I mean, because I always say the penis is like the canary in the coal mine. Those little capillaries down there, if they're not functioning well, guess what? You have other capillaries probably not functioning just as well, like capillaries in the brain. So the tadalafil also helps out brain helps open up the blood flow in the brain as well. So it's a kind of nice side benefit. That's brain and body, brain and bone are there. So and so that NO and the PD5 inhibitors help that out. Also, there's peptides as well that can help out. Excuse me a second. Sorry about that. There's peptides as well that can help out issues with lack of erectile function. For example, there's one called PT141. It's a peptide which you can inject, or you can do a nasal spray that affects the brain directly. It attaches to a melanocortin receptors in the brain. Basically, it stimulates sexual desire, and also can help it increase your erectile function. So it works centrally in the brain. It doesn't work down here.
So that's something you can give to a woman. Can take PT141 as well.
Sure can. Increase
sex drive.
Yeah, arousal in women as well. And there's been studies where it increases lordosis in rats, where it's a sexual behavior where your back kind of hyperextends, and you're ready to thrust.
So how does that differ from oxytocin, PT141?
Well, oxytocin is it's a neuropeptide, which means, it's a neuropeptide. It also increases erectile function, but also there's a secondary benefit, is that whoever you do it with, you tend to bond with. They call it the cuddling hormone, right? The love hormone. You tend to bond with people
like legal ecstasy, huh?
Yeah, kind of like that. You can do that. So you can you just be careful who you're doing that with, because you'll bond with them. Okay, there's a bonding or a love. There's a connection that happens. So with oxytocin. So that's a great one. You can use those as a combination, actually.
And that's also is that injectable? Is that a nasal?
That can be either. Most likely used as a sublingual troche. But it can be IV. It's just given out for IV for women, but it's hard to do that, right? I guess you can make an injectable out of it, but it's I mainly give it through oral troche form. Underneath the tongue.
That's a good. I know that's real popular right now. Oxytocin, PT141,
right?
Tadalafil.
And tadalafil, right? You can use all those in combination, right?
Yeah, I think them blended together. You just take one. They've got all three.
You ready to go?
ready to go. Like a superstar.
You'd be, yeah. And so there's other things you can do as well. There's, I'm sure you know, if you heard of the Bimix, Trimix, and Quad. These are injections you can inject right into the penis. There's no need for sexual desire or hormones. It will just give you, you'll be a rock star for about 3 hours with this type of medication you inject right directly into the penis. But it's kind of, you have to do it right before sex, and you don't
want to like do it and go to Costco or anything like that, or
right. You want to.
That could be very inconvenient.
You have to stop everything, go to the bathroom to inject.
Around,
right? It works, but it can be problematic that way. And then there's the Priapus shot, otherwise known as the P shot, where growth factors are introduced right into the penis so you can stimulate growth, new architectural change with growth factors derived from your own blood. So blood is derived from you, taken from you, spun down, and the growth factors are concentrated and then reintroduced into the penis. And that's called the P shot. It's platelet-rich plasma that's injected. It stimulates growth, stem cells, growth factors. And so you can actually have an architectural change, better blood flow, more sensitivity. And also, this is sometimes happens, sometimes it doesn't, but increased girth or increased length with the P shot.
Have you seen that increased girth?
I have seen increased girth with the P shot. Yeah. It doesn't happen every time. And usually it's after multiple P shots. You can have more than one.
No, I've seen guys that get exosomes or stem cells or Wharton's jelly injected into their penis.
Yeah, you can do like PRP along with stem cells, Wharton's jelly, or some kind of stem cell derivative. That's usually with people if they have multiple things going on. Let's say they're not just a guy who wants to be on their game. They're a guy who's obese or smoker, diabetic, high blood pressure. All these things are stacked up against you. So you have to you have to rise against that. So you need more things to fight against that, like exosomes or Wharton's jelly. Those things can be overcome. Those things should be treated medically and controlled as much as possible because they're affecting the endothelial damage, the blood vessel damage. So you do need these regenerative proteins or regenerative medications to really override that. So the more of those issues you have, the more of those treatments you need to do. But totally doable.
Well, when you add the GainsWave in with the P shot, do you see a better effect, or do you see a better effect just on the P shot or just on GainsWave?
No, I think the GainsWave actually has better effect because you're doing, first of all, you're getting two mechanisms right on the GainsWave. GainsWave is a acoustic wave therapy where it makes an acoustic wave, right? The very tip of the wave, it creates a little cavitation, which is a disturbance, and that disturbance, the momentary disturbance, creates allows signals, growth signals come in where you have growth factors and stem cells all come in, flood the area. So it's after multiple thousands of pulses, you get a great signals in that area. So two mechanisms. The first mechanism is that it does break apart any kind of plaques, any kind of atherosclerosis in the arteries or veins. So you have that work pretty quickly, right? So you have better blood flow just from that. That's the one mechanism. The other mechanism is that over time, those growth factors, it's not going to be working that first day from the growth factors. It takes time for that to kind of heal and change the architecture. And so over time that you have a better architectural change within the penis itself. You have the arteries, veins, capillaries are actually better. They're a better quality. And you can actually have a better sensation as well. So that's where I noticed it, but it's more of a longer term. You need multiple treatments with the GainsWave, the acoustic wave therapy. But you throw PRP on that, that's great.
It's like icing on the cake.
It's great. Yeah, it's a great combination treatment.
So if a guy's in Ohio or anywhere, you're in Ohio, but you can treat any guy. Do you do telehealth at all, or do they have to come see you in Columbus?
No, I treat guys through telehealth. I also have practice in Nashville, a regional practice in Nashville as well.
Nashville's a great city.
Yeah, it's going crazy there.
That was the last time I saw you was in Nashville.
That's right. That's right. So I in
Uh,
Nashville.
yeah, really fun city. So if a guy's coming to you and he's in his 40s and 50s and he's like, you know what, my brain doesn't work, my body sucks, and I haven't had a boner in 10 years, you can get him on the path to good health in weeks, months. Episode is brought to you by Gainswave. If you're a guy who is not achieving optimal performance in the bedroom, and you've tried the pills and you've tried the shots, and you're looking for an all natural way to boost blood flow in the penis, Gainswave is evidence-based and proven. Go to gainswave.com and find a provider near you.
Oh yeah. I need the baseline lab. I want to know exactly where they're at. Right. And we can start that, I talk to them, maybe do a consultation either here or through, telehealth, and we'll get that order for them, get them going right away, either on testosterone therapy or supplements to really get their ED going, kind of mitigate their ED. Like for the Gainswave, you have to come in office. I have to do the treatment itself, but you can certainly do NO supplements, the oxytocin, the PT141, sildenafil. We can do that over the telehealth. So yeah, that's no problem there. Yeah.
Now I know you've been doing this probably, I know since 2006, 2007, probably
That's
even
right.
earlier.
2006.
2006.
Yes, man.
Well, like we've been in this industry a long time. And I think the thing is that you see now, like back in 2006, we were the kooks. We were the ones that, like in the conference, they're like, well, what are these guys doing trying to help people stay young and healthy?
Right.
And now what you do is mainstream to the point where there is a so-called age management doctor on every street corner. So I guess my question is like, is this something where they should be seeing anybody, or how important is the experience? How important is it that they see a very good practitioner?
Well, you'll see, and I've had patients like that before coming in here. At the end of they see people like that, but it's very unipolar. It's very it's just one hormone. It's like testosterone to exclusion of everything else, right? They're not looking at adrenals, not looking at thyroid, not looking at anything else, just testosterone. So you can optimize testosterone, but if you don't optimize the adrenal glands, you feel like crap, Mm-hmm. So you should look at that, and it should be integrative, right? Everything should come together. The hormones, look at that at their ED, at weight loss, body form, aerobic, anaerobic, exercise, and how to optimize that. But it's going to be a quality issue. It seems like everybody at least is treating hormone replacement therapy through testosterone.
Yeah,
it seems to be unipolar, not really total encompassing or integrative.
I can always tell when I'm speaking to a practitioner, like I can tell when people are passionate. You're always going to learning events. You're always learning about the latest technology. And I think like the telltale sign, if I was looking for a good age management practitioner, if you call a doctor and they're telling you how much testosterone you need before they looked at your labs, if they have a one size fits all approach,
right,
run. If they're not doing peptides, run. If you're not actually talking to the doctor and you're talking to the nurse practitioner or to the PA, and you're not talking to the doctor doing the actual prescribing or going to the learning events, run. It's
right. Yeah, that is prevalent, by the way. The nurse practitioners or different kind of offices are all doing HRT. It seems like everybody's kind of jumping on the bandwagon here. But it's going to be a quality issue.
Well, what's the next bandwagon? Like now that everybody's on this bandwagon, you're so forward thinking, like what are you looking at next, saying this is going to be the big thing that everybody will be talking about in 5 years?
Well, I'm sure you know about it. It's regenerative medicine. Regenerative medicine is using stem cells, either stem cells or derivatives, placental stem cells or exosomes for, joint rejuvenation, total body rejuvenation. You can give it, you can inject it right into a joint area. You can inject IM, you can put it IV for cell renewal therapy. So that is an area that is.
You're doing that now, correct?
I'm doing that now. Doing that now here and also in Nashville.
Now, if they want to, if somebody's listening to this and they want to learn more about you, where can they go? What's your website?
I've got, it's polarisrejuvenation.com, polarisrejuvenation.com.
We'll put that, by the way, in the show notes. You don't have to spell it out.
Okay. And a Biologic MD as well. Still there was a website for the Nashville one, but I'm not on there yet. So I just started there.
Well, congratulations in Nashville. Great city.
Yeah, it is a great city. I love that city. So, and then I do want to talk about weight loss, because
that's another huge problem. No pun intended, by the way. But that is a big problem. And you don't see a lot of people, like you see these weight loss clinics popping up everywhere, but the obesity rates are still getting larger and larger every single year.
It's out of control. So I used to say, when people come in, I can handle all these things with hormone replacement therapy. What we do here, probably the most difficult one is weight loss. It can arrest weight gain with hormone replacement, but we can't guarantee weight loss. Sometimes it happens, sometimes it doesn't. But I have to tell you, there's a game changer now. Game changer for weight loss that can really help out a lot of people. Okay. So that being said, I do say that, for weight loss, you want to optimize hormones. I do recommend like a caveman type diet, where what would cavemen eat? An animal, right? Meat and bushes, or, some berries on a tree or a bush, and, some veggies. So that's good, meat, veggies, and fruits, but no, nothing that's boxed, right?
No Oreos.
No Oreos. Yeah. Caveman would not eat Oreos.
I don't think so.
Those carbs, those reduction carbs, you lose weight, you just will. Okay. So that's one way. Okay. And another way is using a restricted plan of eating, where you only eat within a certain time period during the day. For example, either 10 hours a day or 8 hours a day you eat. The other 16 hours you don't eat. For example, 12 to 8 you could eat. Noon to 12, noon to 8 at night you can eat. But there's 16 hours you don't eat. The theory behind that is that, food is nutrients, also toxins. And so you take the nutrients in, you give your body about 16 hours to detoxify itself. And so there's been studies, I think it was gerbils, where they give gerbils the same amount of calories in intake. One gerbil ate it all day long. The other gerbil only ate it within a 10-hour window. Though, and same amount of calories, same amount of food. The one who ate all day long became fat, became obese, high blood pressure, diabetic, and the other one, which ate within that 10-hour period, was lean and had no issues. So it's not just when you eat; it's not only just what you eat; it's also when you eat. You want to kind of restrict that eating window, so your body has time to detox from it. So that is it's called the 8-hour diet plan. I recommend that to my patients as well.
But you said there was also like a game changer.
Yeah, there is. The game changer is injection. Pretty recent. It's called semaglutide. It's made for weight loss. It's an injection you give yourself a very small amount in the subcutaneous tissue once a week. And that works on your brain directly. It's a GLP-1 glycogen-like peptide 1 agonist. It works right on the brain to really satiate yourself. So you have reduced calorie intake. You're just not as hungry. It also optimizes your insulin, so your insulin is a little bit better. But you can have dramatic weight loss. We had dramatic weight loss up to 40 pounds, a couple months. At first month you'll lose poundage, second month even more, and third month more, as long as you keep on going. You can stop at any time, or you can stay on a maintenance program of the semaglutide injection. So it is a very powerful. It can really help you lose weight. So that is a game changer, I think, in my book.
And you've seen that work across the board with your patients?
Yeah, I've seen it work by some patients here. That's right. We have a beta testing site that also shows a fantastic, over 200 patients, big time weight loss.
That's amazing.
So semaglutide is the first generation of that type of medication. The second generation is called tirzepatide, which is coming out, which is just as powerful, if not more. So this game changer for anybody who wants to lose weight. So I'm excited about it. I think it's going to, everybody wants to lose weight. So you lose weight, the world kind of changes. So it's an easy way to do it. But I also recommend obviously the diet, exercise, in a
I
diet.
guess when you're not as hungry, it makes it easier to do an intermittent fasting diet, or to do any type of weight loss. Like, it's easier to stay away from food.
Yeah. Well, we had patients who were resistant to everything and lost 45 pounds over 2.5 months. So did everything in the world. So, so it's a game changer. So I'm excited about it.
So, and you could do that via telehealth as well, right?
Oh yeah, you can do that telehealth as well. Correct. Yeah.
Yeah, that's.
I'll show you how to. If you don't know how to inject, I'll just show you how. I show people how to inject. It's very easy, very straightforward.
And it's like a vial lasts 4 weeks, 8 weeks.
That's right. About what the first vial works 1 month, and the second month you had 2 vials, and that lasts for 1 month because you could slowly incrementally you increase the dosage. And the third month you have a higher concentration of vial, and so your dosage will actually decrease a little bit that you should actually inject. But you're getting more and more every month, and so it's a slow ramp up period.
Yeah, no,
you should be losing weight of all those months as well.
I haven't tried that yet, but I'd like to give it a go. I'm going to try that.
Oh, I think you enjoy it. You don't look overweight to me, but I want to try it out as well.
To try it. But no, I appreciate your time. I think we've covered brain, we've covered body.
Well, I can. Well, there's a couple more things that can optimize your how your body form. Right. There's 2 things actually.
What is that?
And I don't know if I can tell trade names or I can just tell the concept. But I do have a couple of trade names here. The first one is fitness, right? You want to have aerobic fitness, right? And also anaerobic fitness. Mm-hmm. So anaerobic fitness means weight resistance training. And so it's good to have a resistance training across the board, right? Upper extremity, lower extremity, because that increases testosterone, increases growth hormone. Resistance training is usually about 2 hours at a time. You're really hitting all your muscles, right? It's a workout. So how can you biohack that? How can you get that same kind of resistance training without doing the resistance training? Well, there's something called a electrical muscle stimulation. There's a company out there which makes a electrical muscle stimulation suit, where you put on the suit, you put on these trousers, you put on a vest, you put on arm pads. So you have these pads that hit your quads, your hamstrings, your abdomen, your chest, your mid back, upper back, and low back, also your triceps and biceps, and your lats, all at once. The problem was in the past, it was not integrated like this, and so you have these wires everywhere. It was just a big headache putting all these pads together, or you can only do one body site at a time. It took forever to do. This takes about 20 minutes. And this 20 minutes is equivalent to a 2-hour heavy duty, no nonsense, heavy duty workout. Wow. But you're actually recruiting more muscle fibers. You're recruiting about 90% of all your muscle fibers in this.
You're doing that in Ohio or in Nashville?
I'm doing this in Ohio.
That's amazing.
Yeah. And so it's a suit that for out of the 20 minutes, you have total contraction time of 10 minutes, right? So 5 seconds long where it contracts and 5 seconds off. But so you have total 10 minutes contraction time, 90% of all your muscles. So even a heavy duty workout will not do that. So it feels like afterwards, it feels like you had a heavy duty workout. You're sore for days afterwards. You had a workout. Your body had a workout. The beauty of this, it doesn't put any stress across joints. There's no wear and tear. But you do have hypertrophy of muscles, and you increase your strength over less time. It's a beautiful suit.
Yeah, I've tried that before. I did that for a couple months, and I lost a ton of fat and gained a ton of muscle. I mean, it's an amazing, and it's hard to find people that are really good at actually doing those training programs, because if you do it too soft or too hard, you don't get the best results. So that's
right. Yeah, there's a wide variety. You can do it very light, or you can do it very. This is it's a medical grade device.
It's amazing.
It's more than you can handle. You can't go all the way to the top that
Yeah.
device can do, but it will, you'll in 20 minutes, you'll sweat, you'll be your heart will be pounding. You have had a workout.
Yeah.
It compresses a 2-hour workout.
Giant TIMS unit on your whole body.
Right. So yes, but you're having a forceful contraction. You can have forceful contraction of all your muscles.
That's amazing. So you're like, you get a guy on testosterone and you hit him up with one of those workouts every week or 2 of those workouts a week, he's going to have amazing results.
Amazing results. And during the workout, you actually go through range of motion. So it hits your whole belt, the whole muscle. If you stay in one position, it just shocks that muscle in that position. It's kind of good to go through the whole range of motion, kind of get the whole muscle belly activated. So that helps out the anaerobic your workout. So if you throw a regular workout on top of that, great, even better. But I'm telling you that really makes a difference in your muscle mass and also your body form. You had a great workout. So the other thing, now that was anaerobic. Now about aerobic. So there is a new technology. It is where it's called a reduced exertion, high interval intensive training, right? A reduced exertion, HIIT. So you're doing a HIIT, but reduced exertion. So it's a type of bike. In this bike, if you go on this bike 5 minutes, total 15 minutes per week, it's equivalent to like running half an hour, 5 days a week in your cardiorespiratory fitness.
It's a bike. It's a stationary bike.
It's a stationary bike. Yeah. Now it's not a regular stationary bike. It has artificial intelligence in it. So the pedals will automatically sense your strength and kind of give you the adequate resistance. So that it's every ride is never the same. You're always being challenged on every ride. So every ride on this bike, it starts off very slow, pedaling for about a minute and a half, and then you have this hyper intense. You have a 20-second go all out ride, and that's where it's kind of giving you pressure back on the pedal. Go all out like your life depended on it. You've got about a 2-minute relaxation time, 2.5 minute work relaxation, not relaxation, but slow pedaling time, and another 20-second HIIT. And so the idea behind that, and then you have a slowdown. The idea behind that 220-second all-out HIIT program is that during those, it's only for 220 seconds, and those 220 seconds go through your ATP. Mm-hmm. It activates all the glycogen reserves you have. So during that short period of time, you only have about 15 seconds of glycogen reserves. You burn through all your glycogen reserves. And then because of that, the very end of that, it increases these signals, these cell signals, which increase your cardiorespiratory fitness. Mm-hmm. There's something called transducin 1 and something else. Oh, yes. Cyclic AMP increases those. All these cell signals create a cascade, which increases your cardiorespiratory fitness. So you're more aerobically in shape. As a matter of fact, after 8 weeks of doing this three times a week, your VO2 max increases by 12%.
Amazing.
It's amazing. There's nothing that does that.
I've never, because I always thought of VO2 max as something that it's genetic. Like you can't really, it's hard to increase it.
Well, that is, you're right. You're correct. So after age 30, VO2 max drops by 10% every year, every 10 years after that. So if you're increasing by 12% in 8 weeks, you're kind of anti-aging yourself by 10 years. I mean, conservatively. So this increases your VO2 max, and studies have shown you have decreased waist circumference, decreased incidence of diabetes. All these.
And this stationary bike, though, is done at your office as well?
No, this you can buy this. You can buy this bike and take it home.
Is there where do they get the bike at?
It's called the Carol AI bike. CAROL AI bike.
CAROL AI bike.
Yeah, the idea is that you have the super maximal resistance on every ride. Every ride, you have to go all out for 20 seconds. And every ride is, as you get better, the body rises to your challenge of your body because your body's better. So you always get a super maximum resistance. It's beyond those 20 seconds are beyond your 20 or beyond your road capacity. Like you're winded at 20 seconds. You can't do this on a normal bike. You could go out, run, like do a hit outside, run real fast. It just won't be the same as this 20-second.
Carol bike.
Carol. Yeah.
I'm looking at it right here. That's really cool.
Yeah. So then you got your anaerobic, you got your aerobic, you got your hormones, your body's come together.
Well, so you're the guy, like, and I've always had a lot of respect for you because I know a lot of practitioners. And one thing I love is that you're really, like, a lot of doctors are focused on low T, one thing,
right,
or sexual wellness, one thing, or weight loss. It's very hard to find the doctor who ties all of that together and is passionate to, we're talking about AI bicycles. So we're talking about electric suits. We're talking about injections that make you miraculously lose weight. We're talking about gains weight. We're talking about peptides. Like, we covered a lot of stuff in 45, 50 minutes here.
Right. And I always say that I like to do practical things that transfer, I always say if you're not transformed, you don't notice anything different, then it's not worth coming to see me, right? You want to transform somebody, you want to really make a real difference. Like, this is real. That's real, Dr. Garcia. So I always pride myself on that, make a real difference. So yeah,
that's great. I'm actually checking out the Carol bike as we speak. I think I'm, they're not.
You got one?
They're at 2,500. Looks like not too bad.
Yeah, it's not too bad. And it's once you do your workout, you've done your workout for the day. I mean, they're talking 3 times a week. If you do it 5 times a week, my goodness, I mean, you are aerobically in shape. All you need is those 2 20-second times.
I wonder if it helps with your road bike, because I road bike a lot.
Right.
I actually broke my road bike, so I don't road bike anymore because I cracked the frame. But the hardest thing is I'm road biking. It's hard to break through, like, use a power meter to see how much you're powering, and it's very hard. Like, you have to pedal a lot and bike a lot to improve how far you ride, how powerful you ride. But this bicycle looks like it does that really quick.
Oh yeah, it takes you right there. They do say that you could do those hits 3, 4 times, 5 times. Mm-hmm. You can do it more than twice, but you're already maxed out at 2 20-second runs. It's like turning an on button. Once you turn the on button, you can't press it any more times. It doesn't make a difference. You already created the cell signal to create change with your cardiorespiratory fitness after 2 20-second all-out runs in that 5-minute bike ride.
Well, I appreciate everything, and I thank you for the knowledge. I thank you for, like, I'm learning every time we talk, or every time I actually do one of these shows, I learn something new. So, and I've learned a lot today.
Okay, great.
And definitely, if anybody would like to talk to Dr. Garcia, be in the show notes. An amazing doctor. You've been doing this now for, like I said, 2 decades, which in this community it's a long time. So, and experience does count. Thank you so much. I appreciate it.
You take care. Have a good day. Bye-bye.
Take care. That's